the same old thing. Mornings start with a wake-up call. On News Radio 1120 KPNW.
We need to call that the bell of quality, or the ding of something of import.
We'll work on that.
The ding of importance.
Yeah. By the way, Mr.
The savings bell.
Mr. Highland, thank you for the mention in the letters to the editor, talking about the national anthem being played. If you check out the Register Guard today, there is that letter. And, hey, our honor to do it, our pleasure. And also, somebody talking about coming here from Indiana and being charged full price an adult ticket for their baby, their 7-month-old baby, which I'm sure did not need his or her own little seat to watch it. I'm sure they were going to watch from a lap, and yet they're getting charged, $300 plus for the passes in? They say, yeah, Tracktown, USA, also the anti-baby city of the country. That's kind of unfortunate.
Wow. $300. How much? $100 for the?
I think it said $350 in the letter.
Ouch.
Passes for for the entire week, or a couple of events.
Well, okay. Just saying. Was the kid? I mean, were they? I'm assuming they're thinking the child is going to be taking up a seat. And did all children
at 7 months old?
I'm going to say that's probably what the assumption was. I'm not saying it's right. Don't get me wrong.
Believe me, if I'm putting that out, I'm taking that extra seat and putting whatever I can put there.
I would hope so.
Let me give you the other side of that.
Please do.
So I'm sitting a couple rows up and a little way down from a fairly tall guy with one of these. And this is not in the covered part of the stands, not the east or the west, but down on the finish line in Section U.
Of course.
A guy who's got one of those back seats, like little chairs that fold up, so he's got a back. Tall guy leaning back in it. Got a kid who wasn't a lap, turned out to be a lap kid, but looked like he was more like 18 months or 2 years old. So here, it's really packed, those seats are. And, here's a guy that's taken up more than his space. It'd be like sitting next to somebody on an airline seat who tilted it back. And, you're in the exit row or in front of it, and yours doesn't tilt back. So, I don't know whether they charged for a ticket for that or not. But if they didn't, it would have been better if they had. So, things are seldom what they seem, and there's nothing so simple that it can't be misunderstood.
Well, I'm thinking if it was that good a seat, they probably got docked the extra ticket, but still didn't
look like it to me.
Didn't deal with your discomfort.
I wasn't discomforted. I was just observing.
Oh, okay. All right. By the way, Gary Conley, just in case you're not familiar, Conley Capital, he comes here every Thursday.
And we had a great experience, too. Wound up sitting in amongst the Wheating family, which was really fun.
Wow.
Yeah. Yeah. I don't know. And a couple of other families that had people in the trials, too. So it was neat on all kinds of levels.
I'd love to meet them because Andrew Wheating seems like such a great kid.
The whole family is just absolutely a class act and terrific. Really neat.
If that's not the case, thank you for making that up. Because
no, I didn't make it up.
No, that's
I have a tendency to call it like it is.
That's true.
So what did they just introduce themselves as? You're sitting there and they're going, oh, by the way, we're Andrew Wheating's parents.
No, not at all. We just kind of figured it out.
Oh, okay.
Over time because they were there essentially all week. Yeah, yeah. So
interesting.
So anyway, yeah, that made it even more special.
We're going to just change topics and because I can't come up with a smooth transition. So we're just going to get into it. Talking a little bit more about Obamacare, the Affordable Health Care Act. And in particular, the big discussion has to do with increases in taxes regarding the Affordable Health Care Act, Obamacare, and in particular the idea of the individual mandate. So let's just kind of start there. It's incremental. In the way that it kind of goes into effect.
It is incremental in the way that it goes into effect from 2014 to 2016. But you might as well focus on 2016 and look at those numbers because that's where it's going to wind up. I think between the way the excise tax is structured and the fact that you'll be able to get health insurance after you're sick because they can't underwrite you for pre-existing conditions, eventually the system will just collapse. And here's the...
Okay, when you say the system, are you talking about the Affordable Health Care Act, that system, or are you talking about the medical system in general, the healthcare system here in the U.S.?
Well, the economics of the healthcare system in the U.S. will collapse and have to be reconstituted in a different way because we have more demand than we have supply, and it's got to be rationed some way or another. And now you've got a lot more demand because everybody either has to have health insurance or pay the excise tax, or they become the demand when they actually need it. The only way that you really can support a system the way we have it now is you have to have a lot of typically young, healthy people who are paying premiums and not using very much to offset the people who are old and paying, or the people who are really sick and paying a little bit of premium relative to what they're using and are, using a huge amount.
Yeah, I think the last 2 or 5 years of a person's life is when they use the bulk majority of their insurance.
Yes, exactly. I've heard, and I can't go to the blackboard and prove it, that 50% of the cost comes for people who are in the last 18 months of life. Mm-hmm. So, but that's a different issue. I mean, that's
right.
The dynamic of the system. And so in the long run, you have to figure out what needs to happen, which means you're going to have some kind of rationing and then work backward from there. But the excise tax, if you choose not to buy insurance, is going to be built so that people are incentivized not to buy insurance, particularly when they can get it after they're sick. If you go out to 2016, then it becomes 2.5% of your adjusted gross income is what the excise tax is, or for one adult, $695, two adults $1,390, three adults $2,085 per year. Now, if you assume that you can get health insurance for $500 a month, which is maybe a little bit questionable, but let's use that. That might be a little bit low. That's $6,000 a year. So you're still incentivized to, even if you're going to pay the $2,085, that's only a third of what it would cost for the insurance. And depending on what your adjusted gross income is. So that's $2,085. At $50,000 a year, your adjusted gross income would be $1,250, 2.5% of it. Okay, so you'd still pay the $2,085. Gets to be a push at $100,000 a year of adjusted gross income, then it's $2,500. The break even on $6,000, or the tipping point on $6,000 is an adjusted gross income of $240,000 a year. And I'd suggest that anybody who's making $240,000 a year is going to be buying health insurance anyway.
Yeah.
As opposed to. So I think over time, not only do you have a tax increase, or do you have a tax, if you tear this bill apart the way some people have, there are a lot of built-in taxes there. It isn't going to carry itself as it was supposed to any more than, let's say, the Halt Center, which way back when was sold as an enterprise that would carry itself and make a little bit of profit, and it's lost money every year since. That was back in the 70s. So that's a non-starter. So what I think happens is that people will just choose to pay the excise tax, and then you're paying a tax, and that isn't going to make them happy.
Well, the deal is, though, I mean, where the rubber hits the road with that is the issue of the healthcare bill, where you can't be denied for a pre-existing condition. So let's say you're paying the $2,085 a year. That's assuming it's a family of three. You're paying the $2,000 a year, and then you're starting to have lower abdominal pains, and you end up at a doctor's office to find out that you have colon cancer.
Now you run down and buy insurance,
and insurance takes care of it. See, I don't. It seems to me that even though the insurance companies are required to cover that, it seems to me that there would be, and I have yet to see anything that says otherwise, that the insurance companies could look at that and go, okay, we can offer you insurance, but it's going to cost you $3,500 a month or more.
Yeah, it could be. I don't know how that piece is going to work, and I don't know that anybody else does either, but there are an awful lot of things in this bill and in the system that don't allow you to discriminate. And so, for example, the health insurance policy that we have for our employees does not allow the insurance company, and we're a small group, to discriminate or underwrite based on their claims experience with us. It's got to be whatever they're charging everybody else, and I don't have any reason to believe that this one is not going to continue to be the case. So I don't know what the answer to that is, and maybe that's a loophole for the insurance companies, at least for a while, but I wouldn't count on it.
But that's when you were saying that this is going to, cause the health system in the United States is going to cause the collapse. It's that aspect of it. You're required to cover whoever it is, regardless of what their medical condition is.
Right. I mean, I think that's. I think that along with the, with the taxes and the disincentive to buy insurance is going to cause the pool to, as opposed to broaden, which was the idea of this, is going to cause more and more people to get out. Opt out and pay the excise tax as opposed to opt in and pay for the premium. And so then you have the economics of the system have the potential at least to become even more unbalanced than they are now.
What about businesses that provide insurance for their employees?
Well, at this point, the businesses have a different kind of penalty or excise tax that they can pay. And, that looks like it will be, at least for many businesses, cheaper than actually paying for the insurance. And so the businesses probably, I believe a lot of them will opt out, pay the penalty or pay the tax also. And again, because they know under this construct, it would look like the employees, if they get sick, they can just go out and get insurance. Yeah, or maybe put themselves on the business's policy. I don't have any idea how that's going to play out, and I don't think anybody else does either at this point.
I've heard that argument before, but I mean, there is nothing really now that keeps an employer or requires an employer to provide insurance for their employees, is there?
No, but what causes that to happen now is competitive pressure. I mean, there's not, very few things are more important to people than health insurance, and so as an employer, if you're providing some kind of a plan, you have a competitive advantage over somebody who isn't. So, I mean, that's it, pure and simple.
Well, then I guess, then I ask the question, what's the benefit for a company to have been providing insurance for their employees and then turn around and go, because we're talking about a competitive advantage, to turn around and go, yeah, we're not going to do that anymore. We're going to pay the fine and or the excise tax, and we're just going to let it go. I mean, you're going to have, in a situation like that, you're going to have a lot of PO'd employees, particularly those that are taking the company insurance.
Well, maybe, but it depends on how you construct it. And, given given these mandates, I mean, the system's changed. So the competitive advantage, may not be there anymore. One of the things you could do is just simply pay the excise tax for the employee instead of, I presume, in some form or another. Haven't thought that all the way through and don't know enough to know how the ins and outs of it would work. But when the system's changed, you've got a lot of smart people out there, particularly in business as well as individuals, who are going to figure out how to not so much game the system, but just, use it to their own best advantage. And, then you get as you always do with these kinds of things, a lot of unintended side consequences. And, we'll see what those are like over the next 5 years or so as this gets phased in. But I don't see this as being particularly helpful in terms of funding health care.
Gary Conley, the president of Conley Capital, give the website.
ConleyCapital.com.
See, it's that simple. Thanks for joining us, Gary, as always. We'll see you next Thursday.
And I'll give you a little tease because there are we can talk some more about this next Thursday because there are some things that may make the system more economic, as we talked about a little bit off the air. We don't have time to get to it now, but maybe we'll talk about what some of those are next time.
All right, sounds good. So part 2 of the conversation coming up next week. Gary, thanks for joining us.
As always, it's a pleasure.